Uh, Good afternoon. My name is Craig Sessions. I'm the Southeastern Regional Manager with Rocket Medical. Uh, Not to be confused with Rocket Mortgage. We're definitely not quite as big, but we're rapidly, hopefully, moving in that direction. I was asked to come in and do an in-service with our pleural and peritoneal drainage devices. Um, Before I get into that, I'd like to give a quick little background of exactly who Rocket Medical is, because most people have not heard of us. But Rocket is a family-owned and operated company. It was founded back in 1964 on the north side of London over in the UK. And we do a number of different medical devices and products, in vitro fertilization, some urology things. But our bread and butter has been in malignant pleural and peritoneal effusion cases. In fact, outside of the US, we are the worldwide leader in this type of procedure. Here in the US, we're newer and most people have not heard of us. Well, that's because our biggest competitor, who I'm sure you are familiar with, a company called Plorex, has had a patent on these type of devices that recently expired. So it's now allowed us to come into the US, develop a sales force and a clinical team, and establish a very large corporate office just outside of Boston and go out and promote our products. And the ironic thing is we don't do anything differently than Plorex. Our catheter is the same length, it's the same diameter, it's the same number of fenestrations. The only difference is there's our valve, which I'll get into in a little bit. But where we really shine in difference is that, number one, we are 35 to 40% less expensive, typically, sometimes even more, across the board in both our insertion sets as well as our drainage kits. Secondly, we offer options when it comes to drainage. When we have a pleural case, we have a 1 liter and a 500 milliliter vacuum bottle, which is important. It's a must-have because the chest is full of negative pressure, which means it has to be sucked out using a vacuum type device. But in addition to that, we also offer a 2-liter gravity bag, and that is for abdominal cases where you have positive pressure in the belly. So a gravity fed bag is the only thing that you need, and that's in 2 liters. So that definitely can get a lot more fluid out of that than you can the pleural space, where you risk things such as dyspnea by taking more than a liter at a time out. So we offer those variety of options for you and the cost savings. And then most importantly, what's special about Rocket is that we provide coverage for every patient, regardless of insurance or ability to pay. So when they leave the hospital, the physician has the utmost confidence that the patient is going to receive all of their drainage products without any problem whatsoever. So we're there to support the patient and support you every step of the way and kind of alleviate the headaches. In fact, I like to give a shout out. I give credit to one of my interventional pulmonology nurse practitioners at Vanderbilt University, her name's Charla, who has stated many times through other facilities, switch to Rocket and all your headaches go away. And we're really proud of those types of comments about us. But anyway, so that's Rocket in a nutshell. So I'll go ahead and go into an actual in-service of the product. Now, as I said, we have both the insertion kits and the drainage kits. So we have, as a company, we have two different fights. The acute side, who's actually placing the catheter, be it the hospital or an outpatient surgery center, and then the post-acute, where experts such as yourselves come into play to do the actual hard part and the most of the work with draining the actual patient. But I'll go ahead and show you what the catheter looks like. This is a Rocket catheter here. This is how it will look when you undress it and the patient comes to your facility or you're at their home. This has a cap on it that is flat and blue. And we designed this, as we did all of our products, with patient comfort in mind. So for example, if I show you the Plorex catheter, which looks just like this with the cap on, when the cap is off, if you can see here, there's a little pin on this round part. And this tends to jut into the patient's skin when you're doing a pleural, when it's placed in the pleural space. When they put that arm down, that can jab into their skin. So we designed ours to be nice and flat and smooth to make it a little bit more comfortable for the patient. So this is our catheter. This is the Rocket catheter. I'll go ahead and take that cap off. So when the cap is removed, they both look just like this. All right. Ours has two little pins here on the side, if you can see that, which is important. Oh, and I lost my video. Sorry. Okay, there we go. Which is important to help lock the catheter in place when we go to, or the bottle in place when we drain. And here on the Plorex, you can see there's nothing that locks to it. It was made to break away. But if we go into an actual drain, this is the 1 liter bag. It comes in a, or 1 liter vacuum bottle. It comes in a sterile bag just like this. Product code is on top here. And we open this up, and inside we have the bottle itself. And then we have our dressing kit that's in here, as well as instructions on how to use it, how to operate. But this is very, very simple. You will not need these. So if I open up the bottle bag, just like this. Now this is my demo one, so it's been used before, but when you open it, the cables will be taped to the bottle in a nice little configuration like this, and there's a blue tape that comes all the way across. So we rip off that tape, which actually is the hardest part of the whole procedure, by the way. We rip off that tape. We now have our extension line, which is extra, extra long. And what this is important because this gives the ability to keep the bottle down by the patient's side while they're sitting at in their dining room table or in their lazy boy recliner. Because even though we are using a vacuum, the gravity does help in getting a lot of that fluid out. So a couple of neat little key features that we have on here. First and foremost, unlike Plorex, we have 4 feet on the bottom here. That's to help prevent it from tipping over, which you won't find on any other bottle. Then here on the top, we have 3 different components. The first being this little accordion vacuum indicator. This lets me know when it's fully decompressed, such as this, that the bottle is active and has vacuum pressure in there. If it was fully expanded, if you can see it's up a little bit now, I could push down on that, but it would be up to here. That would tell me that the bottle is bad. The vacuum has already been expired in here. If that's the case, with anything, if you're not getting enough drainage or anything out of it, just let us know. We'll replace these 100% at no cost. So we want to make sure you're taken care of. So we have the vacuum indicator. Here on the top, we have our drainage line with a slide clamp, just easy on and off. Everybody knows how to use that. And then finally here in the middle is a little tab. So once I'm done draining, I can then take this tab off, and there's a foil seal here. If I turn this tab over, I can puncture that seal, take my bottle, dump that down the toilet, and then double bag it into a Walmart or Target bag and throw it right in the garbage. It also allows me to get access to the fluid if for any reason I need to take a sample or anything like that. So these are 3 unique things to Rocket that we have on our bottles. And as I said, our extra long cable here to give you that room. In the middle is what actually activates the drain itself. This is a total push button control. So this allows the user, the patient or the nurse, to introduce the patient to drainage, so they're not the initial shock can be very jolting sometimes, especially what they're used to with the Plorex bottle. So once you start that drain, you can't stop it. It's a roller clamp and it's very hard to manage. So this allows you to adjust the flow rate and ease the patient into it. I can do that either by titrating, pushing a couple of times till the patient is comfortable. If they are comfortable, this little blue slider here can then be pushed up and lock that button down in place, and the flow will continue naturally. Another thing that I can do is this little blue slider is built on a ramp. So if I start to slowly push it forward, you can see that button slowly depress. And then once the patient is okay, I can then lock it into position and do the same thing. If I want to stop draining, just undo this. It will stop draining immediately. I don't have to worry about the slide clamp or anything else. We have that. And then finally on the other end is just the tip. It has a protective sterile cover on this. This is the most important aspect of any drainage procedure, is trying to maintain sterility across the board. So in order to help fight all of that and get this together, we'll go ahead and do a drainage. So if I take my dressing kit that comes in the packaging, it's a blue sterile wrap. I will open this up, and in here I have sterile gloves. One size fits all. I prefer the other ones, but they still work. There's a cap that fits the Rocket catheter. There is an adapter and a cap which fits the Pleurex catheter, which I'll get into in a few minutes. We have plenty of alcohol wipes, an emergency clamp. If I have any problems with the line itself, I can clamp that off. I have a split gauze, plenty of extra gauze, and then our bread and butter in the kit is our dressing cover, which is every nurse that I ever talked to, this is their favorite part of our dressing kit. Guaranteed not to stick to your gloves and come off nice and easy. No more slapping yourself in the face with getting stuck to the Tegaderm and whatnot. So we have that, and we'll show that in just a few. So if I put my gloves on, I then take my catheter, get my Rocket catheter here, as everything just fell in my lap. So if I have my Rocket catheter, I can just take the end of my bottle. I take an alcohol wipe, I clean this off, keeping it as sterile as possible with my gloves on, open the sterile cap. Then this little straw will insert right into the one-way valve here. And then there's two little pins that I had mentioned before. You can see here, there's little notches on each side. They just quarter turn and it snaps right into place, creating a secure connection. So I have my bottle ready, I have my button ready, and all I do is I remove the slide clamp and depress the button. Fluid starts to flow. As I said, I can titrate, I can do the ramp capability, lock it into place, and the fluid will flow into the bottle. When I'm done draining, I just open it up and it's completely stopped. So I then can clean off, I unhook, take another alcohol wipe, clean it off, and then I have my cap right here. It's a half moon shape. You can see that, which will now cover the catheter, and there's two little pins, locks right into place. And I'm all set and ready to go. Now, while we are fighting as a company to get into the hospitals to have our catheters used in these procedures, most places are still using the Pleurex catheter. They've had the market for a long time. In fact, they have about 80% of the market share. So most oftentimes you will see this catheter implanted. So if I have my Rocket bottle, which is being used by home health and hospice because of the comfortability to the patient, but more importantly, because of the significant cost savings, they'd like to use our deep drainage devices with the Pleurex catheter. If I have the Pleurex catheter and I insert this into their valve, there's nothing to attach it to. It can just pop right off. So that's not very good. So as I mentioned, in each kit, there is an adapter that comes. This little adapter looks like this. One end is round and the other end has 4 pins on it. See there? If I take the end to my bottle and the adapter, 4 pins slides right over the straw, and then just a simple push and it's snug into place. And now I could take that Pleurex catheter, insert the straw, and a quarter turn locks it in place, and I now have a secure connection to the Pleurex catheter. Drain is the same. I open up the slide clamp, depress the button, and let the fluid flow into the vacuum bottle. When I'm done, same thing, quarter turn counterclockwise, remove the bottle. Again, I can puncture the foil seal, dump that in the toilet, double bag it. This goes right into the garbage. And then with the catheter here, take an alcohol wipe, clean it, and then each kit comes with a Pleurex cap that'll just screw right on, and I'm good to go. So that is the drainage. So if there are any questions, please feel free to stop at any time and ask. I'll then move into showing you how to dress. So I have my little pleural model here. If I put this in. So when I'm done draining, it'll look just like this. So I take my split gauze. There's a white side and a tan side. White side is for absorption, so we want to make sure that is down. That'll allow the absorption of all the sweat and things that can occur underneath this. I can then coil up my catheter, keep it here. I take some extra gauze. I place that right on top. and then I can move into my actual dressing cover. Now, if you notice, the dressing cover is numbered. Well, the number 1 here on the sides is number 2, and then on the front, number 3. So if I remove number 1, just in steps, part 1 comes right over my gauze. Comes right over the gauze and the catheter itself. I then flip up underneath, and I have step 2. Just pull these off the side. They get flattened down. And then finally, last part, number 3, just reach in here and pull these 2 apart. I'm now completely dressed, covered. This is watertight. Patient can take a bath. We even say they can go swimming with it. It is that watertight. So it's nice. It's secure. Everything is as sterile as possible, and the patient is hopefully feeling comfortable. So that is the gist of an actual drainage. So as I mentioned, though, we're all about options. So we also have a 500 milliliter bottle. Don't know if you will use these, but if you ever do, nothing is different from the 1 liter except for the size. It is the same connection at the end. It's the same push button. The only difference here is the middle tab. While we can puncture the foil seal on the 1 liter and get to that fluid, this one is self-enclosed. There's just not enough room. So this tab in the middle will not break off. So once you drain, this just gets double bagged, thrown away. You cannot get into the fluid here. And then finally, as I mentioned, we also provide a 2-liter bag. This is a gravity bag for abdominal cases such as ascites or anything else you're doing. So by guidelines, we do not want to take more than 1 liter out of the lung space and no more than 2 liters out of the abdominal space. So we have a 2-liter bottle, the 2-liter bag. The connection is exactly the same. You can use the adapter, but the only difference is it's not a push button anymore. It is a roller clamp. So that's locked. That is open, and this would need to be down by the patient's side below them because we use gravity to make this active. And with both, of course, patient positioning can be key too. If you're finding you're not getting a lot of the fluid out, have the patient turn over a little bit or maybe lay on their side or adjust. And then 9 times out of 10, you'll see that an increase in the flow into the drainage containers. If at any time that we do this in service now and you don't see a patient for a few months from now and you kind of forget how to do this, we like to say we try to keep it as easy as possible. It's not rocket science, it's Rocket Medical. But if you ever do feel like you need a refresher and do not have access to any of these videos, each bag, the cover that the bags come in has a little QR code here. You can take your smartphone, take a picture. It'll immediately pull up our homepage, and on there are nice, quick little videos that will go through and show you the exact same thing that I just showed you. A couple little tips and tricks that I'd like to show just to keep you aware. With these slide clamps, these are on there for a long time. So when you do slide these off, sometimes this little rubber can still stay pinched together. Think of it like a straw. And as you continue to squeeze it, it loses its round shape. So if you just squeeze the edges, you can bring that roundness back out and open up that valve to let the fluid come in. We also recommend not changing the dressing I just showed you more than once or twice a week. This is very tacky, so the more that you lift up on the skin and put it back down, it can start to irritate if you're doing it multiple times again and again and again and so on. So this doesn't have to be changed except for just once or twice a week, the actual cover, and eliminate that rash or whatever that can occur if it does occur. Again, if at any time you find that the bottle is not getting a full 1 liter, you have to get another bottle, things like that, just let us know. If you ever have an issue, we will replace these, no problem. One other thing I like to educate everybody on is when a patient receives a catheter, be it Rocket or Florex or anybody else, I'll go through a little quick step-by-step because this might come into play with you too. But they get the physician or the nurse at the hospital or outpatient fills out what's called a certificate of medical necessity. Ours is a one-page form, looks just like this with some check boxes and little things. Others are multiple pages. We try to keep it simple. But on here is the patient's name, their insurance information, their address, what their diagnosis, primary and secondary diagnosis, whether they're getting home health, whether they're going to home health, hospice, home with no nurse, just little check boxes, as well as if they're getting bottles, bags, and how often they're draining. And this gets sent directly to us. When we receive this, we immediately send the patient, based on the address that's there, 3 free drainage kits, whether it be bottles or bags. And that is to bridge the gap between insurance verification and shipping of the actual product to the patient. So we want to make sure that the patient always has their drainage supplies no matter what. So we immediately do that with the 3 free. And at the same time, with those 3, we send them one of these. This has nothing to do with you personally. As a home health nurse, you will not have to use this. But we have had some individuals see this and think, oh no, I'm forgetting to do something or whatnot. But that's not the case at all. This is an emergency drainage kit that we provide. And if you ever see this, all it means is that this is for the patient to take with them if they ever have an emergency and need to go to another hospital or another physician or another floor of the hospital. It has a drainage line in there with connections to hook the patient up to wall suction or Pleurovac, as well as instructions and things like that on how to use it, so that whoever is taking care of that patient knows exactly what they're dealing with, how to handle it, how to use this, and so on. So if you do see this bag in the patient's home, don't worry about it. This is just an added benefit for the patient. Sometimes, and Mary and I had just spoken about this recently, and I had somebody from Atrium run through this situation. While majority of patients are still receiving the Pleurex catheter and going to home health, such as Atrium Home Health, when they get discharged from home health and they're on their own, they would like to still continue using the Rocket bottles and the Rocket bags. If that's the case, you may be required to fill out this CMN. As I showed you, it is very easy. Very simple. It's just mostly check boxes, and you already have a majority of this information on hand anyway. But we need this filled out and sent over to us so that we can now take over that patient and provide their kits for them, because they're going to be expecting the Pleurex bottles, which look like this if nobody has seen it. Very short line. It is a roller clamp, no feet. It's a puncture device. You have to tap down. So we've improved on that, but they will get those instead of the Rocket if this is not filled out. I am available at any time to help walk you through this form. We also have it available directly on our website, usa.rocketmedical.com. There's a little blue box right at the top right of the page, or at top middle right of the page. It says physician form, certificate of medical necessity. Click on that. It can be filled out, then just fax right into our office, and Rocket will handle everything from there. So that is it. That is the whole process of Rocket's Drain, how to use it, how to troubleshoot. I hope you enjoyed it, and I hope you find as much pleasure using us as we enjoy you using us. So, are there any questions?
I think you've covered everything, Craig. I really appreciate your time, and I will direct the nurses. If you do have questions about using the Rocket, please feel free to touch base with your clinical manager, your CSS, or me. I'll be glad to help you. Thanks.
Fantastic. Thank you very much, Mary.